Have you ever noticed a certain smell that lingers around some elderly people? Is it simply a part of aging? Or could your daily habits be to blame? And most importantly, what can you do to prevent it before it becomes a problem? Many older adults assume that taking their medications or visiting the doctor when they feel sick is enough. But what if the real issue isn't illness? It's what you're overlooking in your everyday routine. This video will take you deep into a surprising but important topic, the so-called old person smell, and its direct link to overlooked hygiene and common daily habits. You'll want to stay until the end, because we're not only revealing what causes this embarrassing condition, but also the simple, science-backed steps that can help you avoid it completely. This isn't just about smelling good, it's about maintaining dignity, independence, and the confidence to enjoy your golden years fully. You'll discover how subtle changes in your body chemistry after 65 make you more susceptible to lingering odors, and what role personal hygiene, diet, environment, and even your wardrobe play in it. So before we dive in, if you find this kind of content valuable, give this video a thumbs up to support our mission of healthy aging. And if you haven't already, consider subscribing and hitting the bell so you never miss practical tips like this. Ready to take control of your health in a whole new way? Let's begin. The annual wellness visit is far more than just another box to check. It's a strategic health checkpoint specifically designed to catch small problems before they become serious. One of its core strengths lies in early detection and individualized health planning. Rather than waiting for illness to appear, this visit takes a proactive approach by evaluating the full picture of your health and helping you plan for the future. The goals are clear and impactful. First, it involves a holistic health evaluation. This means reviewing any recent changes in your overall health, updating your medical history, and looking closely at lifestyle choices that may influence your long-term well-being. It's not just about what's happening now, but also about identifying trends that might signal something deeper. Second, there's a strong focus on chronic disease management. Many older adults live with ongoing conditions like hypertension, diabetes, or arthritis. This visit helps ensure these are being managed properly, with any needed adjustments made to medications, routines, or treatment strategies to optimize control and comfort. Third, the visit aims to identify and reduce risks, such as fall hazards, cognitive decline, or complications related to medications. It's a chance to spot red flags before they turn into emergencies and put in place smart solutions, like adjusting prescriptions or recommending mobility aids. Fourth, the appointment includes preventive care coordination. This ensures you're staying up to date on important health screenings, routine blood work, vaccinations, and lifestyle counseling, all of which can ward off more serious problems down the line. Finally, there's future health planning, which often gets overlooked. The wellness visit provides space to talk about your wishes for future medical care, including documents like advance directives. These discussions, while sometimes difficult, help ensure your preferences are respected if health complications arise later on. By addressing each of these areas, the AWV not only strengthens your physical well-being, but also supports your independence, lowers your risk of hospitalization, and enhances your overall quality of life. Let's now explore one of the most essential parts of this visit, the comprehensive review of your health and medical history. During this time, your doctor will sit down with you and go over everything in detail. That includes your current health status and any changes since your last visit. They'll update your medical history by noting any new diagnoses, hospital visits, surgeries, or events that may have occurred in the past year. Additionally, your physician will ask about any new or worsening symptoms, like fatigue, pain, shortness of breath, or a noticeable change in appetite. That could be early signs of an underlying condition. No concern is too small to mention. And to round it out, they'll also revisit your family medical history, since genetics can play a major role in predicting potential risks and shaping your preventive care plan. A comprehensive health review doesn't stop at your symptoms or medical history. It also considers your predisposition to serious conditions like heart disease, cancer, or dementia. These genetic or family-related risks can significantly influence which screenings your doctor recommends and how often you need them. But there's more. The visit also includes an evaluation of social and lifestyle factors, which many people underestimate. Is your living environment safe? Do you have a reliable support system? Can you easily access nutritious food and transportation for your appointments? All these elements, often called social determinants of health, can quietly shape your long-term wellness. By exploring these areas thoroughly, your doctor creates a personalized health profile, unique to your circumstances. This isn't just about collecting information. It's about painting a full picture of your life to identify risks early and develop interventions that are truly tailored to you. Next comes the management of chronic conditions, which is one of the most critical parts of the annual wellness visit. Chronic illnesses like diabetes, high blood pressure, arthritis, COPD, kidney disease, or heart failure are widespread among seniors, and managing them requires more than just taking daily medication. The AWV gives your doctor a chance to closely monitor the progression of these conditions, measure key health indicators, such as blood pressure, blood glucose levels, or cholesterol, and assess how well your current treatment plan is working. Have your symptoms improved? Are your medications still effective? Any troubling side effects? These questions are not just routine. They help your doctor decide whether your medications need adjusting or if new therapies should be explored. The AWV also allows time to coordinate care with specialists, such as cardiologists or endocrinologists, making sure all aspects of your health are aligned. Just as importantly, your physician will educate you on how to take charge of your own care, whether that means checking your blood sugar at home or sticking to a low-sodium diet to protect your heart. When done right, chronic disease management during the AWV doesn't just prevent complications, it dramatically reduces the risk of emergency room visits and helps you feel more in control of your life. Another essential element of the wellness visit is medication reconciliation. As we age, the number of pills we take often increases. Prescriptions, over-the-counter drugs, herbal supplements, you name it. This is called polypharmacy, and while it may be necessary, it also raises the risk of dangerous drug interactions, unwanted side effects, or even duplications in treatment. During your wellness visit, your doctor will take the time to carefully review every medication you're currently using. They'll record each drug's name, dosage, how often you take it, and why. This isn't just about paperwork, it's about evaluating whether all those medications are still serving a purpose, especially older prescriptions that might no longer be relevant or safe. The physician will also screen for harmful interactions, whether between two drugs or between a drug and a supplement, that could increase your risk of side effects, like excessive bleeding, drowsiness, or dangerously low blood pressure. This step is crucial for your safety and peace of mind, especially if you're seeing multiple doctors or specialists. To ensure both the safety and effectiveness of your treatment, your doctor will also take the time to evaluate how well each medication is actually working. Are the drugs doing what they're supposed to? Are there any side effects that are interfering with your daily life, such as dizziness, fatigue, or confusion? If any red flags appear, your physician may suggest simplifying your regimen, possibly by combining medications, lowering dosages, or switching to alternatives that are better suited for your body. Remember, as we age, our liver and kidney function naturally slows down. That means our bodies don't process medications the same way they used to. Medication reconciliation is not just a routine checklist, it's a critical safeguard tailored to these physiological changes. It helps prevent serious drug interactions, ensures you're not over-medicated, and keeps your treatment as streamlined and effective as possible. Now let's talk about one of the most vital aspects of prevention: screenings and vaccinations. Preventive care is the heart of the annual wellness visit. Instead of waiting for illness to appear, it focuses on catching issues early and protecting you from preventable diseases before they take hold. Your physician will guide you through the recommended screenings and vaccines based on your age, risk factors, and personal medical history. One of the first lines of defense is the influenza vaccine. Doctors recommend getting this shot every year, ideally in the fall, since flu season can be especially dangerous for older adults. Seniors face a higher risk of complications like pneumonia or even hospitalization. That's why specialized versions of the flu shot, such as high-dose or adjuvanted vaccines like Fluzone High Dose or Fluad, are often suggested for those over 65. These offer stronger immune protection designed specifically for aging bodies. Another critical vaccine is the pneumococcal vaccine, which protects against serious conditions like pneumonia, meningitis, and bloodstream infections caused by Streptococcus pneumonia. Most adults over 65 will receive PCV20, Prevnar 20, a single-dose vaccine that covers 20 strains and is sufficient in many cases. However, some individuals, especially those with chronic health conditions or previous vaccination history, may also need PPSV23, Pneumovax 23, for added protection. Your doctor will thoroughly review your vaccine history and risk factors to recommend the most appropriate plan. Then there's the tetanus, diphtheria, and pertussis booster, commonly known as Tdap or TD. This booster is recommended every 10 years to keep your immunity strong, particularly against whooping cough, a serious respiratory infection that can be more dangerous in older adults. Often, a one-time Tdap dose is given first, followed by TD boosters every decade. And finally, we can't overlook the importance of the shingles vaccine. If you're over 50, doctors recommend Shingrix, a 2-dose vaccine that helps prevent shingles, a painful rash caused by the reactivation of the chickenpox virus. This isn't just a mild inconvenience. Shingles can lead to severe nerve pain and long-term complications if left unaddressed. All these vaccinations, carefully tailored to your age and health profile, serve one clear purpose: to keep you healthy, resilient, and independent for as long as possible. This vaccine is crucial because shingles isn't just a rash. It can lead to a condition called postherpetic neuralgia, a type of chronic nerve pain that may linger for months or even years after the rash has healed. Shingles results from the reactivation of the varicella zoster virus, the same virus that causes chickenpox. And here's the key point. As we age, our immune defenses decline, making the risk of shingles much higher for older adults. Depending on your individual health risks and environment, additional vaccines may also be recommended. For example, the RSV vaccine, designed to protect against respiratory syncytial virus, can be particularly beneficial for older adults with chronic lung or heart conditions. Similarly, updated COVID-19 boosters may be advised, especially if you live in a community setting or have existing health vulnerabilities. Now, let's talk about key screenings, powerful tools that help catch serious illnesses while they're still treatable. One of the most essential is the colorectal cancer screening. Colorectal cancer is often silent in its early stages, but highly curable if caught early. For most individuals at average risk, a colonoscopy is recommended every 10 years, starting between ages 45 and 50, and continuing until about 75. However, if you've had polyps or a family history of colon cancer, your doctor may suggest more frequent screening. Alternative screening options include sigmoidoscopy, usually done every 5 years and sometimes combined with stool-based tests. Speaking of which, there are non-invasive tests like the fecal immunochemical test, FIT, which can be done annually, and multi-target stool DNA tests such as Cologuard, typically recommended every 3 years. After age 75, the decision to continue these screenings is personalized, depending on your overall health and life expectancy. For women, breast cancer screening is another priority. Most guidelines suggest mammograms every 1 to 2 years for women aged 50 to 74. The specific schedule can vary depending on which organization's recommendations your doctor follows, such as the American Cancer Society or the U.S. Preventive Services Task Force. After age 75, screening decisions should be individualized, weighing your current health status and future risk. In some cases, additional imaging like breast ultrasounds or MRIs may be recommended, especially for women with dense breast tissue or elevated cancer risk. For men, the discussion turns to prostate cancer screening. This usually involves a prostate-specific antigen, PSA, blood test, and, in some cases, a digital rectal exam. However, it's important to know that PSA screening is not one-size-fits-all. While early detection can be life-saving, overdiagnosis and unnecessary procedures are real concerns. That's why doctors recommend a shared decision-making approach, especially for men aged 55 to 69. For those over 70, or men at higher risk, such as those with a family history or African American descent, individualized discussion is even more critical. Lastly, we can't forget about bone health. A DEXA scan, also known as a bone density scan, is recommended for all women aged 65 and older to screen for osteoporosis, a condition that dramatically raises the risk of fractures. But it's not just women who are at risk. Men aged 70 and older, as well as younger individuals with risk factors like long-term steroid use, low body weight, or a history of fragile fractures, should also be evaluated. This painless scan measures your bone mineral density and plays a crucial role in preventing debilitating fractures. Depending on the results, this scan may need to be repeated every 2 to 5 years to ensure bone health remains stable. Next is the abdominal aortic aneurysm, AAA screening, a simple but potentially life-saving test. A one-time ultrasound is advised for men aged 65 to 75 who have ever smoked, as smoking greatly increases the risk of developing an AAA, which can silently enlarge and become life-threatening. For individuals with a family history of TAA, including women, screening may still be considered based on clinical judgment. It's one of those silent conditions that often go undetected until it's too late, unless you proactively screen for it. Vision and hearing assessments are also part of the annual wellness visit, and while a comprehensive exam with an ophthalmologist or audiologist is ideal, your primary care provider may begin with basic in-office evaluations. For vision, they might use the Snellen chart, the classic eye chart you've seen at many doctors' offices, to evaluate any decline in visual sharpness. This simple test can help detect common age-related eye conditions like cataracts, glaucoma, or macular degeneration before they begin interfering with daily life. When it comes to hearing, your doctor may ask if you've noticed any difficulties or perform a basic whisper test, which is a surprisingly effective tool for detecting early hearing loss. As you know, diminished hearing isn't just a minor nuisance, it can affect your communication, safety, and social engagement. If any irregularities are found, you'll be referred to a specialist for further evaluation. Now, let's talk about something often overlooked but absolutely vital: lung cancer screening. For adults aged 50 to 80 who have a significant smoking history, defined as smoking the equivalent of 20 packs a year, and who currently smoke or quit within the past 15 years, doctors recommend low-dose CT scans annually. Lung cancer is often called a silent killer because its early stages may have no symptoms at all. This simple screening can catch it early, when treatment is most effective. Another key area is cardiovascular risk assessment. During your wellness visit, your doctor may calculate your 10-year risk score for heart disease by evaluating factors like age, blood pressure, cholesterol levels, and smoking status. Based on this score, your physician can provide tailored recommendations, whether that's lifestyle changes, starting statin medications, or discussing the use of low-dose aspirin therapy in certain cases. Of course, we can't ignore diabetes screening. For individuals with risk factors such as obesity or a family history of diabetes, your physician may recommend regular testing. This can include fasting blood glucose, hemoglobin A1C, or even an oral glucose tolerance test, depending on your profile. Typically, these tests are done every 3 years, but if early abnormalities are found, they may be done more frequently. After all, catching pre-diabetes or early diabetes gives you a head start in reversing or managing it effectively. And now, we move to something that impacts not just your physical health, but your independence: the assessment of functional status and fall risk. Falls are a major cause of injury among seniors, often leading to broken bones, head injuries, and even permanent loss of independence. That's why during the annual wellness visit, your doctor will assess your mobility and balance. You may be asked to perform the timed up and go TUG test, which helps measure how safely and quickly you can stand, walk a short distance, and sit again. Your gait and posture might also be evaluated to uncover hidden risks. The doctor will begin by identifying any signs of instability through a careful review of your recent fall history. Even something as small as a minor slip that didn't lead to injury can be an important signal. By asking about near falls or stumbles, your provider can assess hidden risks that might otherwise go unnoticed. They'll also evaluate your home environment for common hazards, like loose rugs, poor lighting, or cluttered walkways that can silently increase your chances of falling. Simple adjustments, like adding handrails or improving lighting, can make a world of difference. Have you ever considered how just one overlooked detail at home could change your safety overnight? Additionally, your provider will screen for underlying conditions that may be contributing to instability. This includes identifying issues such as orthostatic hypotension, where blood pressure drops when you stand up, vision problems, which can throw off your balance, or muscle weakness, especially in the legs. Once these contributing factors are recognized, they can recommend specific interventions. These might include physical therapy, balance-focused exercises like Tai Chi, or even the use of assistive devices such as canes or walkers. In some cases, a home safety evaluation by an occupational therapist may be the best next step. Preventing falls isn't just about avoiding injury. It's about preserving your independence, your confidence, and your quality of life. One bad fall can lead to a hospital stay or months of recovery, and that's exactly what this visit aims to prevent. The sixth component is mental health and cognitive screening, which is essential but often overlooked. Emotional and cognitive well-being are central to aging well, yet issues like depression, anxiety, or early dementia frequently go undiagnosed in older adults. During the annual wellness visit, your doctor may administer brief but effective tools like the Patient Health Questionnaire 2, PHQ-2, or PHQ-9 to evaluate symptoms such as low mood, lack of interest in hobbies, or persistent fatigue. For anxiety, the provider may ask about feelings of restlessness, ongoing worry, or sudden episodes of panic. These can sometimes be triggered by life transitions, such as retirement, loss of a spouse, or chronic illness. Identifying and addressing these symptoms early can make a significant difference in your overall resilience. Cognitive screening is also conducted using brief, structured assessments like the Mini-COG or Montreal Cognitive Assessment, MoCA. These tests help detect mild cognitive impairment or early stages of dementia by evaluating memory, attention, and executive function. Substance use screening is another important part of this evaluation. The physician may ask about your current or past use of alcohol, tobacco, or even prescription medications, since misuse of any of these can worsen both mental and cognitive health. If concerning patterns are found, your provider might recommend counseling, medications, or referrals to specialists like psychiatrists, psychologists, or neurologists for further care. Next is lifestyle counseling, which is the seventh pillar of the visit. While it may sound basic, making the right choices in daily habits is foundational to long-term health. The doctor will offer personalized guidance on nutrition, encouraging a diet high in fruits, vegetables, whole grains, lean proteins, and healthy fats. These choices aren't just about maintaining weight, they support your heart, brain, and muscles. For patients with specific conditions, such as hypertension, dietary advice might focus on reducing sodium. For those with diabetes, it could include practical tips on carbohydrate counting or maintaining consistent blood sugar levels. Your provider will also encourage physical activity tailored to your capacity. The general goal is at least 150 minutes of moderate aerobic activity per week, such as brisk walking, cycling, or swimming, along with muscle-strengthening exercises twice a week. If mobility is limited, the plan can be adapted. What matters most is consistent movement. To continue supporting your overall health, the annual wellness visit also includes a review of your daily habits, particularly those that affect your energy levels, mobility, and mental well-being. One crucial yet often overlooked area is sleep hygiene. Many older adults experience sleep disturbances, which can lead to fatigue, irritability, or even memory lapses. Your physician may recommend strategies like sticking to a consistent bedtime routine, limiting screen time before bed, or avoiding caffeine and heavy meals in the evening. These simple adjustments can go a long way in helping you wake up feeling more refreshed and steady on your feet. Stress management is another important piece of the puzzle. Whether it's dealing with loneliness, financial concerns, or the challenges of aging, chronic stress can take a toll on both your physical and emotional health. You might be surprised how effective small practices like mindfulness meditation, deep breathing, or even joining a community group can be in lifting your mood and easing tension. For those who still smoke, smoking cessation is strongly encouraged, no matter your age. Quitting can significantly improve cardiovascular and respiratory health, enhance circulation, and reduce your risk of cancer. Your provider may offer helpful resources like counseling or nicotine replacement therapies to support your journey. Alcohol moderation is another vital area discussed during lifestyle counseling. For older adults, the general recommendation is no more than 1 drink per day for women and 2 for men. Beyond quantity, it's also essential to be cautious of how alcohol might interact with your medications, especially those for blood pressure, diabetes, or mental health. Altogether, this counseling empowers you to take a more active and informed role in your health. When you're equipped with the right tools and support, preventing chronic disease becomes more achievable, and that translates to more freedom, vitality, and peace of mind in your daily life. Next is advanced care planning, a topic that many shy away from, but one that offers priceless clarity and peace during uncertain times. The annual wellness visit creates a safe space to talk about your preferences for future medical care while you're still healthy and fully capable of making decisions. This includes reviewing or establishing advance directives, such as a living will that spells out what kind of medical interventions you do or do not want, and appointing a durable power of attorney for healthcare, someone you trust to make medical decisions on your behalf if you're unable to do so. These conversations also include discussing your goals of care. For example, would you want CPR, mechanical ventilation, or feeding tubes in a life-threatening situation? It's not always an easy conversation, but it allows your values and wishes to guide the care you receive. For individuals facing serious illness, your provider may also explain palliative care options, which focus on comfort and quality of life, or hospice care for those at the end of life. Most importantly, the doctor ensures that your decisions are properly documented in your medical records and shared with your loved ones or healthcare proxy. These steps not only safeguard your autonomy, but also greatly reduce the emotional burden on your family during medical emergencies. After all, when everyone knows your wishes, they can honor them with clarity and confidence. Finally, the visit wraps up with a personalized health risk assessment and preventive care plan. This isn't a generic checklist, it's tailored to you. Your doctor will summarize the most important findings from your visit, such as high blood pressure, signs of osteoporosis, or cognitive changes, and then lay out specific next steps to keep you on track. This may include scheduling a colonoscopy, initiating a new fitness plan, or adjusting medication regimens. With this clear roadmap in hand, you'll leave your appointment not only more informed, but truly empowered. After the annual wellness visit concludes, your doctor will provide you with a personalized health roadmap tailored to your specific needs. This includes a clear summary of findings from the visit, whether it's elevated blood pressure, a dip in bone density, or a noted change in cognition. Based on these insights, your physician may recommend practical next steps, such as starting a gentle exercise program, adjusting existing medications, or scheduling targeted follow-up appointments to manage chronic conditions more effectively. One essential part of this wrap-up is the follow-up plan, which includes scheduling your next annual wellness visit, usually 12 months later. In addition, if any concerns were raised, like irregular heart rhythms, poorly managed diabetes, or signs of memory issues, your doctor may recommend seeing a specialist sooner or arranging interim checkups to track your progress. To support your journey between visits, your doctor may also provide educational materials. These might include guides on fall prevention, tips on healthy eating for seniors, vaccine schedules, or exercises tailored to improving balance and strength. These resources empower you to take charge of your health throughout the year, not just during that one appointment. Now, you might be wondering, why is this annual wellness visit so important? The answer lies in the immense value it brings to not just you, but your family and the broader healthcare system. The AWV is designed to catch health issues early, before they become more serious or harder to manage. Conditions like prediabetes, early-stage cancers, or mild cognitive decline can be detected when there's still time to make a real difference. It also plays a key role in managing chronic diseases. When conditions like hypertension, arthritis, or heart disease are closely monitored and adjusted proactively, you're less likely to face severe complications and more likely to enjoy a better quality of life. On the prevention front, recommended vaccinations and screenings during the AWV can protect you from illnesses like influenza, pneumonia, or colorectal cancer, which can be particularly dangerous as we age. Another major benefit? Cost savings. Preventive care reduces the risk of expensive hospital stays, emergency visits, and long-term care needs. That's not just a relief to your wallet, but also to your family and caregivers. And perhaps most importantly, the AWV supports your independence. By keeping your physical, mental, and functional health in check, you're better equipped to continue living life on your own terms, doing what you love with the people you love. Best of all, for most Medicare beneficiaries, the annual wellness visit is completely covered. That means no out-of-pocket costs. It's a valuable, accessible, and cost-effective way to invest in your long-term well-being. To get the most out of your next visit, a little preparation goes a long way. Start by compiling a complete list of all medications you take, including prescriptions, over-the-counter drugs, and supplements, along with their dosages and frequency. This helps your physician review for potential interactions or outdated prescriptions. Next, jot down any recent health changes. Have you noticed any new symptoms, recent falls, shifts in your mood, sleep patterns, or appetite? These details are easy to forget, but can provide critical insight during your visit. It's also helpful to review your family's medical history. Updating this information, especially if relatives have experienced conditions like heart disease, cancer, or dementia, can influence your own screening and prevention strategies. Before you go, be sure to write down any questions you'd like to ask, whether about vaccines, screenings, or specific health concerns. And if you've recently received care from another doctor, urgent care, or a specialist, don't forget to bring relevant records or summaries to provide a complete picture. Finally, take a moment to reflect on your values and future care preferences. Having this clarity makes it easier to talk about advanced care planning if the topic arises, helping guide decisions that align with your personal wishes. Arriving well prepared for your annual wellness visit not only makes the appointment more productive, but it also allows your physician to tailor recommendations that truly align with your current needs and health priorities. One crucial document to have ready is your advanced directives. These legal documents help ensure that your care preferences are honored should you ever be unable to communicate them yourself. Being ready with this paperwork removes confusion and allows your doctor to respect your wishes without hesitation. The AWV is specially designed to address the distinct challenges older adults face as they age. That's what makes it such a powerful preventive tool. For example, natural age-related changes, like a gradual decline in kidney function, muscle mass, or even a slower immune response, can alter how your body reacts to medications or how effective certain vaccines are. These subtle shifts might not be immediately obvious, but they have a significant impact on your overall care plan. Another reality for many older individuals is multimorbidity, which simply means managing more than one chronic condition at a time, like heart disease, arthritis, and diabetes. In these cases, coordination between doctors and careful adjustment of multiple medications is essential to avoid dangerous interactions and reduce complications. We also must not overlook the emotional and social dimension. Loneliness, limited social support, or the loss of a longtime partner can significantly influence both mental well-being and adherence to treatment. Feeling isolated often makes it harder to stay motivated to follow through with medical advice or engage in health-promoting routines. In situations where someone is experiencing cognitive decline or has more complex health needs, it's incredibly helpful to involve a trusted caregiver or family member during the annual wellness visit. Their presence not only enhances communication, but also ensures that follow-up steps are understood and completed properly. Think of it as building a health support team, right in the exam room. We also have to be mindful of health equity. Not every older adult receives the same level of care. Factors like limited access to services, language barriers, or cultural differences can affect the quality and clarity of the visit. Physicians are encouraged to use interpreters when needed and approach each individual with cultural sensitivity, making sure every voice is heard and respected, regardless of background. It's important to understand that while the annual wellness visit is foundational, it's not the only piece of the puzzle when it comes to healthy aging. It works best when integrated with other aspects of your routine healthcare. This includes regular care from specialists, such as cardiologists, rheumatologists, or endocrinologists, who help manage more complex or long-term conditions. In addition, comprehensive eye exams, either annually or every 2 years, are essential for detecting issues like glaucoma, cataracts, or macular degeneration, conditions that can silently affect your vision and safety. And don't forget dental care. Oral health often gets overlooked, yet it plays a big role in your ability to eat well and avoid infections that may even affect the heart. Scheduling regular dental visits helps maintain your nutrition and overall systemic health. Beyond medical appointments, community resources can be a powerful support system. Local senior centers, exercise programs, and nutrition services like Meals on Wheels provide social engagement, physical activity, and reliable meals, all of which contribute to long-term well-being. Finally, remember that follow-up visits between annual wellness visits are just as important. These appointments help address sudden issues, adjust treatments, or monitor chronic diseases in real time. When combined with the annual wellness visit, they help build a solid, proactive healthcare framework, one that supports healthy, independent aging and gives you peace of mind for the road ahead. As we grow older, our bodies naturally become more vulnerable to a range of health challenges. Conditions like cardiovascular disease, type 2 diabetes, osteoporosis, arthritis, certain cancers, and cognitive decline, including forms of dementia. What makes these conditions particularly concerning is that many of them progress silently, without clear symptoms in their early stages. You may feel fine, yet something serious could be developing beneath the surface. That's why annual wellness visits are so important. They provide a critical opportunity for healthcare providers to perform comprehensive screenings and diagnostic tests, each one tailored specifically for the needs of older adults. These aren't just routine checkups. They're designed to catch problems before they become life-altering. Take blood tests, for instance. With just a small sample, doctors can uncover imbalances in cholesterol levels, blood sugar, or kidney function. These findings could point to early warning signs of diabetes, hypertension, or even chronic kidney disease. And when caught early, these conditions can often be managed with simple lifestyle changes or medication adjustments, preventing them from escalating into something much more serious. Cancer screenings also play a pivotal role. Whether it's mammograms, colonoscopies, or prostate exams, detecting malignancies at an early stage can significantly improve your chances of successful treatment. That's because cancer, when found early, is often much more treatable, and in some cases, even curable. Then there's bone density testing, which can diagnose osteoporosis before a fracture occurs. Rather than waiting for a hip or spine fracture to reveal the problem, these tests help us intervene early, when preventative strategies still have time to work. Cognitive assessments are equally important. Subtle memory lapses might seem like part of normal aging, but they could also signal the earliest stages of dementia. With early detection, healthcare providers can offer interventions, both medical and lifestyle-based, that may help slow the decline, protect independence, and maintain quality of life for longer. All of this points to one truth. Early detection is not just about knowing what's wrong, it's about catching small issues before they become major ones, and giving the body and mind a better chance at fighting back. This is especially critical for older adults, whose resilience against advanced disease may be lower. When intervention happens sooner rather than later, the outcome can be dramatically improved. In addition to early diagnosis, another cornerstone of preventive care during annual visits is prevention through vaccinations and lifestyle counseling. Once you're over 65, the risks of infection and chronic disease increase, making proactive prevention all the more important. During your wellness visit, your healthcare provider will review your vaccination history and ensure you're up to date. These aren't just optional shots, they're vital tools for protecting your health. Staying current with vaccines helps guard against diseases that can be dangerous or even life-threatening for seniors. The influenza vaccine, given annually, is one of the simplest yet most powerful tools in preventing severe flu complications that can escalate quickly in older adults. Just one bout of seasonal flu can lead to pneumonia, hospitalization, or worse. That's why this yearly shot should never be overlooked, especially if you're over 65. Pneumococcal vaccines offer another vital layer of protection. Pneumonia remains one of the top causes of hospital admissions among seniors, and with the right vaccination, that risk can be dramatically reduced. Then there's the shingles vaccine, which guards against the painful, blistering rash triggered by reactivation of the varicella zoster virus, the same virus responsible for chickenpox. If you've had chickenpox earlier in life, you're already carrying this virus. And as your immune system weakens with age, the chances of it flaring back up increase significantly. And we can't forget COVID-19 boosters. While some may feel the pandemic is behind us, the virus continues to pose serious threats to older individuals. Boosters are essential to maintaining immunity, especially when your body isn't responding as robustly as it did in earlier decades. But the benefits of annual wellness visits extend far beyond vaccinations. They also open the door for highly personalized lifestyle counseling. This is where healthcare truly becomes about you, your habits, your routines, your health goals. Your doctor may review your nutrition, helping you make choices that keep your weight in check, support healthy blood pressure, or manage blood sugar more effectively. It's not about complicated diets. It's about smart, sustainable eating tailored to your condition, whether it's diabetes, hypertension, or simply preventing malnutrition, which is surprisingly common in older adults. Physical activity is also addressed. You might not be running marathons, but gentle exercises like walking, water aerobics, or balance training can work wonders. These routines are designed not only to boost strength and coordination, but to reduce your risk of falling, one of the most serious threats to independence as we age. Mental well-being is just as important. Annual visits offer a chance to screen for depression, anxiety, or signs of social isolation. Many seniors suffer in silence, believing it's just part of getting older. But it doesn't have to be. These conditions are treatable, and early recognition makes all the difference. By focusing on prevention, these annual checkups become far more than a formality. They become a gateway to empowerment. You're no longer reacting to health issues after they arise. Instead, you're getting ahead of them. Another major advantage of the wellness visit is the coordination of care with specialists. Most older adults are juggling multiple chronic conditions. Maybe you're seeing a cardiologist for your heart, an endocrinologist for your diabetes, or a neurologist for memory concerns. But who's tying it all together? That's the role of your primary care provider. They act as the central hub, making sure all the moving pieces of your health puzzle fit together. During the annual visit, they'll review your full medication list, checking for dangerous drug interactions and ensuring you're not taking outdated or unnecessary prescriptions. This process, often called deprescribing, is especially critical for older adults. With age, our bodies handle medications differently, especially when it comes to liver or kidney function. So even a medicine that helped years ago might be harming you now. Streamlining your treatment plan helps minimize side effects, enhances your quality of life, and prevents hospital visits caused by medication mismanagement. For seniors who take multiple medications, a situation known as polypharmacy, coordination among all your healthcare providers becomes not just helpful, but essential. Your primary care physician serves as the point of communication, aligning treatment plans with various specialists to make sure that a prescription for one condition doesn't accidentally worsen another. Every medication is reviewed, and medical records are regularly updated to ensure a full, accurate picture of your health is always available. This ongoing collaboration reduces the risk of fragmented care. And when care becomes fragmented, it can lead to serious consequences, like misdiagnoses, conflicting treatments, or critical gaps in follow-up. But when everyone on your care team is on the same page, it creates a unified approach, one that is thoughtful, consistent, and focused on you. That's the power of regular wellness visits. They foster communication across your entire care network to build a seamless and effective treatment plan that fits your unique health profile. Another key advantage? Improved quality of life and greater independence. That's what most of us want as we grow older, to stay active, stay sharp, and continue enjoying the life we've built. These annual visits are designed to support exactly that. By addressing health concerns early, your provider can help you manage issues before they spiral into serious problems. For example, consistent care for arthritis pain might mean the difference between enjoying a walk through the park or being stuck at home due to discomfort. Monitoring your blood pressure or blood sugar can dramatically lower your chances of suffering a stroke or heart attack, events that can instantly change your ability to live independently. And let's not forget hearing and vision screenings. Left unaddressed, they can slowly erode your social life and increase your risk of accidents. But with timely interventions like hearing aids or cataract surgery, you regain clarity, confidence, and connection with the world around you. During these visits, physicians also assess your functional status, how well you walk, balance, or remember things. These check-ins can detect subtle changes that, if caught early, can be corrected or managed. Maybe a simple referral to physical therapy can improve your mobility. Or maybe it's a recommendation to install grab bars in your bathroom before a fall happens. These adjustments may seem small, but they can make a profound difference in preserving your independence. Equally important is the financial side of healthcare. Because let's face it, medical costs are a major concern, especially for seniors living on a fixed income. That's where annual wellness visits prove to be one of the most cost-effective strategies in modern medicine. Why? Because they focus on prevention rather than treatment. When you catch high blood pressure early and treat it, you may prevent a heart attack that could land you in the hospital for days. When you manage your diabetes effectively, you avoid long-term complications that are not only dangerous, but incredibly expensive. These visits help you stay one step ahead, minimizing emergency care, costly procedures, or long-term hospitalization. Screenings for conditions like colorectal cancer can play a powerful role in prevention. By identifying precancerous polyps early, we can often intervene before the disease even begins, eliminating the need for invasive procedures or aggressive cancer treatments. Isn't it better to catch a problem before it becomes a crisis? Vaccinations also carry immense value, especially in later life. Illnesses like pneumonia, which may seem like minor concerns in younger years, can lead to lengthy hospital stays and severe complications in older adults. But with timely vaccinations, many of these outcomes can be prevented entirely. The best part? Many of these preventive services, including the annual wellness visit and key health screenings, are fully covered by Medicare for individuals aged 65 and older. That means no out-of-pocket costs. Just think about that for a moment. These services are not only life-extending, but also financially accessible. When taken seriously, they help you manage your health before issues become more severe, saving both emotional stress and financial strain down the line. Now, to wrap things up, annual medical visits truly are a cornerstone of healthy aging. They provide an opportunity for older adults to take a proactive stance toward health, addressing challenges before they grow. From early detection to personalized prevention strategies, from coordinated care plans to focusing on what matters most, your quality of life. These visits are a roadmap to maintaining your health, independence, and peace of mind as you age. And let's not overlook the long-term savings. When health issues are tackled early, the need for costly hospital stays, emergency interventions, or extended rehabilitation is significantly reduced. In that sense, these visits aren't just about better health. They're a wise investment in your future financial security as well. So, let me ask you, what message from today's discussion stood out most to you? Was there one practical insight you're planning to bring up with your doctor, or begin acting on starting today? Take a moment to reflect. Then, we'd love to hear from you. Drop a comment below and share the one key takeaway that resonated with you the most, along with how you plan to apply it. If you found this video helpful, please support the message by liking, sharing, and subscribing to our channel. We've got more practical health and wellness tips tailored just for you. Wishing you continued strength, peace of mind, and vibrant health. And don't forget to subscribe to Healthy Aging Blueprint, your trusted companion on the journey to living well at every stage of life.